Varis hastalığı kimlerde daha çok görülüyor?
Varicose veins are more commonly seen in individuals with a genetic and familial predisposition. People who have a family history of varicose veins, such as in their mother, father, or siblings, are more likely to develop the condition. It is more prevalent in women and is also influenced by one's occupation. Those who spend a lot of time sitting or standing still in their jobs are more prone to developing varicose veins. The likelihood increases with age, becoming more pronounced in the 30s and 40s. Women, especially those who have given birth, are more frequently affected. The condition is often exacerbated by the effects of gravity. The veins that carry blood from our legs back to the heart can become insufficient, causing blood to pool in the lower extremities. This pooling leads to increased pressure in the veins, causing them to expand. Within our veins, there are structures called valves that open to allow blood to flow towards the heart and close to prevent it from flowing backward. When these valves are insufficient, blood tends to accumulate in the legs, leading to the dilation of veins. As a result, the veins near the surface of the skin become more prominent, and the capillaries begin to enlarge and expand. Eventually, the visible appearance of varicose veins forms on the legs. Apart from the visual aspect, patients often experience symptoms such as aching, a sense of fullness, heaviness, and swelling in the legs, particularly in the evening. These symptoms are commonly the reason patients seek medical attention.
Şimdi bizim varislerimiz daha çok genetik.
Our varicose veins are largely influenced by genetic predisposition, but our lifestyle also plays a role in the development of varicose veins. Of course, there are factors that we can and cannot change. The factors we cannot change are those we inherit through our genes. We cannot change our gender. Therefore, by changing our lifestyle, we have a chance to prevent varicose veins or reduce their effects. We can explain it this way. Our leg veins, specifically the superficial veins, carry blood back to the heart. The mechanism works like this. Because our heart is positioned higher, blood in the superficial veins tends to accumulate at the lower extremities due to the effect of gravity. If we can reverse this process, we can protect ourselves from varicose veins and their effects. So, what should we do? We need to elevate our legs and feet to or above heart level. Practically, this means whenever we find the opportunity during the day, we should elevate our feet to heart level or higher. However, this is not possible for everyone. For example, someone working in an office or at a bank cannot do this easily. Therefore, they can perform this action when they get home by lying down and lifting their legs up. Another thing that can be done is to use our leg muscles, particularly the calf muscles, which act as a natural pump. When we move and engage our leg muscles, they compress the veins and help push the blood upwards. Therefore, we need to stay active and move as much as possible to help the blood in the veins return to the heart, thereby protecting ourselves from varicose veins. For those who work in sedentary or standing occupations, such as doctors, cashiers, teachers, barbers, or office workers, the risk of developing varicose veins is high due to their lack of movement. My advice to these individuals is to take a few steps whenever possible at work. For instance, instead of asking for tea or water to be brought to their desk, they should get up and get it themselves. This movement will help activate the leg muscles and facilitate the return of blood to the heart, reducing the likelihood of varicose veins. Another suggestion for those who work sitting down is to perform brake pedal exercises. Just like pressing the gas pedal while driving, they can perform similar movements with their feet while sitting to engage their leg muscles and help direct deoxygenated blood back to the heart. Additionally, patients with such complaints should consult a doctor, specifically a cardiovascular surgeon. We often request a Doppler ultrasound for patients with these symptoms. This imaging technique helps us map the veins in the legs and visualize the valves inside the veins. It also allows us to measure the extent and diameter of the vein enlargement. Based on the results, if necessary, we recommend compression stockings to apply external pressure.
şikayetlere sahip, bu hastalığa sahip kişilerin de dolayısıyla
For individuals with these complaints, it is especially advisable to wear compression stockings starting in the morning, as the swelling and fullness in the legs will have subsided after lying down at night, making it easier to put on the stockings and preventing swelling throughout the day. I recommend wearing these stockings particularly on work days, days when you will be on your feet, during shopping trips, or during long journeys such as bus or plane rides. Regarding the treatment of varicose veins, before starting treatment, we request a Doppler ultrasound to evaluate the valves in the veins and assess the degree of vein enlargement and reflux. Based on the severity, we plan our treatment accordingly. We often encounter insufficiencies in the great saphenous vein and the small saphenous vein. There can also be insufficiencies in the perforator veins, which connect superficial veins to deeper veins. Depending on where the insufficiency is, we tailor our treatment. For visually prominent bulging veins, we perform microphlebectomy, a procedure where we make small incisions to remove these unsightly veins. For the insufficiencies in the saphenous veins, we commonly use laser treatment, which involves inserting a laser into the vein to heat it, causing it to shrink and close. This prevents blood from flowing backward into the problematic veins. Patients often ask if closing these veins will cause problems. It's important to understand that the veins with insufficiencies are already not functioning properly and allowing blood to flow backward, which is harmful. By eliminating this backward flow, we remove the harmful effects. Another concern is whether closing these veins will affect future bypass surgeries. While it is true that we sometimes use the saphenous vein for bypass surgery, we do not prefer using these already damaged veins. We also have alternative options such as internal mammary arteries and arm arteries for bypass procedures. Therefore, there is no need to worry about losing these veins due to laser treatment.
bir alternatif bu damarın
Another alternative method for closing veins is using a glue-based technique called blue ablation. The goal in all methods is to close the vein and prevent backward blood flow. There can also be insufficiencies in the perforator veins. These veins can be treated by identifying them under ultrasound guidance and tying them off with a small incision to stop the abnormal flow. For spider veins, or small capillaries, which are often a cosmetic concern for women, the gold standard treatment is sclerotherapy or foam sclerotherapy. This involves injecting a chemical agent into the veins to cause them to collapse and disappear. Additionally, we recommend compression stockings even after treatment to prevent the remaining veins from developing varicose veins. Another common question is about the recovery time after laser treatment. This minimally invasive or closed treatment method typically requires a short hospital stay. The procedure itself takes about 1 to 2 hours, and patients can usually go home the same day and return to their normal activities the next day. In conclusion, varicose vein disease can be managed through lifestyle changes, appropriate medical consultation, and various treatment options tailored to the patient's condition.